right now, I'm going to introduce you to Dr. Wright. Hi, Dr. Wright. How are you?
Hi, I'm good. How are you guys?
Good.
Good. Do you guys want to learn about some dental stuff today?
Yeah.
Awesome.
Emerson's super excited because she wants to become a veterinarian.
Oh, nice. Excellent.
Yeah.
We need more veterinarians.
Well, there you go. Okay, so it looks like this is pretty high tech.
So we're actually going to be starting a dental in a little while here. So this is already all set up for our next kitty who's going to have a dental.
Wait, a kitty?
Yep, the kitty's going to have her teeth done. So basically, we're at the shelter when we're looking at the animals and checking out how healthy they are. We always check their teeth because just like us, they can have problems with their teeth. And if they have painful teeth or teeth that aren't healthy, we want to take those out so that we can get them pain-free and get them eating well and get them onto their new homes. So this is where we do that. So animals are a little bit different than us though, right? Because you can go in and you can sit in the dentist chair and they can tell you to be still and open your mouth. And you may be a little bit nervous, but at least you can do that. But animals, they're really nervous and they don't understand why we're in their mouth with sharp things. So we actually have them go to sleep while we do their dental procedure. So what happens is we give them some medicine. And that
like anesthesia?
Anesthesia, yep, you're right, you got it.
Good.
So those drugs make them go to sleep. And then we actually put a tube down their throat that protects their airway because they need to be able to breathe while we're doing that. And we need to be able to deliver the medication through the tube and to give them oxygen so that they can breathe. So they get that tube down their throat. And then once they're nice and ready, so the techs do all of that in the other room there. And once they're ready, they bring them in here. And what happens is they'll lay them on this towel. And inside this towel is a heated blanket.
Ooh.
This is a water blanket. So this is really warm. It runs warm water through there.
Ooh, it is nice and warm.
And that keeps them nice and toasty while we're doing stuff. Because when animals and people are under anesthesia, they can get cold. And we don't want them to get cold. So we keep them nice and warm. Then they get a blanket over the top of them. And then this that I dropped.
Ooh.
This is a tube that runs hot air through it. And so we put that under the towel. And then the kitty goes under the towel, and that keeps them nice and warm that way too.
Cozy, very
so they get
cozy.
a nice cozy place, and then just their head pokes out for me, so I can work on their mouth.
Wow.
So and then over here, this is our anesthesia machine. So there's this tube here that will connect up to the tube that's going down their throat. And what that does is that delivers oxygen, and then it delivers an anesthetic gas. Gas's name is isoflurane, and that's a medication that keeps them asleep while we're working on them. So the medicines we give them to start with put them to sleep, and then this gas keeps them asleep while we're working on them. That make sense?
Wow.
Where do you put the shot in them?
We do that back when they're in their first prep cage.
But
So
where
it's in a text
where do you
body?
do it? Like
where do
yeah.
they get it? They get it in their leg. So in the muscle of their leg. And then they fall asleep. And then once we have them hooked up there, this is a monitoring machine. Let's see if I can get it to work on me. So this is going to tell me things like their heart rate, how much they're breathing, tells me how well they're using oxygen, all sorts of things to make sure that they're doing fine under anesthesia. This is not going to read me. Oh,
There we go.
so that's my heart rate. My heart rate's 88 right now, and I'm doing really good on my oxygen use.
Cool. And just from that little piece that you have right on
Just
your
on
finger.
my finger.
Wow. Benjamin, I see that you unmuted yourself. Did you have a question? Ask when you're ready, Benjamin.
Okay. So then other things that we do. So the first thing I'm going to do when I go through their mouths, I'm going to look and just make sure everything's clean, and I'm going to clean it up and everything. And to do that, I use this. This is called a scaler.
Whoa.
And you can see it has a little tiny tip on it.
Yes.
And what happens is it vibrates back and forth really quick. And it has water that comes out of it. And that will take off all of the tartar. So tartar is just stuff that accumulates on the teeth. That's what the dentist is taking off when they clean your teeth as well. So we do that first and make sure the teeth that we're working with are nice and clean. And then we go on and see if there's any teeth we have to take out.
So Emerson, do you go to the dentist?
Yeah.
Yeah, Benjamin, do you go to the dentist as well?
Yeah.
Good. Erin, do you go to the dentist? She's like, absolutely. Awesome.
Do you guys remember what they do at the end when you're done getting your teeth cleaned? Do you remember what they put on your teeth?
They brush it.
They brush them, yep. And then do you remember that kind of like bubblegum flavored stuff that they put on? So that's called polish. And this is what we use to put polish. We do that for cats and dogs too. And it's actually still bubblegum flavored.
Is it?
Yes, it is.
Oh my goodness.
I'm not sure the animals care about that, but it is bubblegum flavored. It does smell good.
Oh, that's so fun.
So this spins really fast. So I can show you. I don't know if you can see that spinning. So that goes on the tooth.
Okay.
So if this is my tooth, I put that on just like that.
Sure.
And that polishes all the teeth.
Fun. Wow. So then let's say that you got that tartar off and you polish those teeth, and then what happens to the animal?
Well, so then I'm going to take some x-rays.
Oh.
Because I want to know what the teeth look like under the surface too. Because I can see what I can see with my eyes.
Yes.
But that doesn't always tell the whole story. So I want to see what's going on underneath. So we have this machine over here. This is our x-ray machine. It's our dental x-ray. It's a little bit different than the x-rays that we take of the whole animal, which is in the other room. And it has this big long arm. And then this is the actual x-ray tube. So this is where the x-rays come out of. So if my animal's sitting here, so say this is his mouth, then I take, this is a little probe. This is what's going to catch all the x-rays. So the x-rays come from this tube, and this plate's going to catch them and read them. So I'm going to put it in the mouth. And what happens is those x-rays come through the tube, through the mouth, through the tooth, and onto the plate. And that's how we get our x-ray. Wow. And then the image shows up on this little screen. And I was hoping I'd have some to show you, but the techs were on their game, and they moved all of them to the computer permanently. So
that's okay. We totally get that. That's just fine. Wow. So then x-rays are taken, you're able to look at them, and then about how long does this take? So let's say you had an animal that had fairly healthy teeth, got some tartar off, able to take x-rays, and about how many minutes would that be?
That'll take about 20 minutes or so to get to this point.
Good.
And then once we start our extractions, it'll depend on how many we have to take out. Depending on the tooth, it may take me anywhere from 5 to 20 minutes to take a tooth out. Okay. And then if we have other teeth to take out, it may take them longer.
So campers, what would be a reason why Dr. Wright would have to take a tooth out of a cat?
Because it had a cavity.
Sure. Yeah.
Animals definitely get cavities.
Or maybe you had to trim it a little bit because it was getting too long.
That is an excellent thought. And that definitely happens in like rabbits and mice, guinea pigs, things like that. In dogs and cats, their teeth are like ours. They don't keep growing. So we don't have to trim theirs. But definitely our small mammals, we have to do that for sure.
Good thought, Emerson. Benjamin, anything else?
Nope.
Okay, thank you. Any other questions so far about why? Maybe one broke off. Maybe that could be.
Do you have to do it on wild animals?
I've done a couple things for the wildlife department, and generally we don't. Generally we're just doing cats and dogs, but every once in a while the wildlife center asks us to do something. Wow. I took a tooth out of a possum not long ago.
You did?
Yep.
What?
A tooth out of an opossum. Yeah, it was pretty cool. Oh. They have lots of teeth.
Oh my goodness, razor sharp.
Well, and I can show you. So this little model just shows you these are cat teeth, and these are normal teeth.
Okay.
But if you look on this side, these are some examples of things that can go wrong with the teeth.
So this tooth fractured off, so it broke off completely.
Okay.
So then you have all of that stuff on the inside of the tooth that is exposed and is painful. This is showing a bunch of tartar. So animals don't brush their teeth every day. Well, if they're really good animals, sometimes we can do it for them, but in general, they don't brush their teeth. So they accumulate all that tartar. And then cats in particular can get a condition where they actually, their body kind of attacks their own teeth and they start to resorb them. So we go in and we take those out because that process is painful for them. So,
wow.
Yeah.
So then when you say reabsorb, the teeth actually kind of melt back into the tissue of their mouth.
Yeah.
Wow. Ooh,
Yeah.
how painful.
Do they grow back?
They don't, no.
Ooh.
So once they start doing that, we just have to take them out. And dogs and cats really do fine. There are some animals that, because of various things, they lose all of their teeth.
Oh.
And that's okay. They still can eat. They can still eat dry food. They can still eat wet food.
Sure.
And they don't really care if they run around with an empty smile, like, you know, whereas we might be a little bit self-conscious about that. They don't care. So they do fine with that.
And knowing dog and cat owners, as we know, our animals usually just take a mouthful of food and swallow it anyway. So sometimes they don't need to crunch it.
Yes. Yeah.
So then after that, where do they go? What's
So
going
after
on?
that, they're going to go into recovery. Do you guys like to see recovery?
Sure, if you have time.
Yeah.
Here we
Come
go.
on in here.
Ooh.
They're doing some prep stuff here already. So
Okay.
this is dog recovery. So this is where they come, all the dogs will come after they're done, whether it's a dental or whether it's a spay or neuter surgery, they would come in here.
Okay.
And then the techs can all keep a good eye on them. So they're
Busy
all
working.
ready and waiting.
Busy working. Everyone's busy working.
Here's Kelsey recovering.
Oh, hi,
He's just,
Kelsey.
so he's just waking up from surgery. He's cute, isn't he?
Oh, and that's one of the jobs of someone who's able to take care of an animal afterwards. Just give them some hugs and kisses and pets, and look it, soon enough that animal will be up and ready to go. Awesome.
This is our kitty recovery.
Oh.
Or what?
This is where all the cats recover.
Are there any cats in there?
There's a couple cats in there right now. Yep,
Can
they're
we
waiting
see
for their partners.
Sure. Can you see them?
Kinda.
Can you see them now?
Yeah. So what happened to them? And why do they need to
Well,
recover?
so this cat in the front, that's our dental cat.
Oh.
So he's waiting to have his dental.
Okay.
And then the other kitty is getting neutered.
Oh, so it's a boy?
Yep.
Mm-hmm. Good. Thanks. Wow.
And then Dr. Senevec is doing some surgery right now.
Yep. Looks like
On a cat?
That is a puppy.
it's a puppy. Yep.
And why does it need to have surgery?
So it's getting spayed. So we're making it, again, so it can't have babies.
Yeah. And they are completely in that moment of operating. They're ready. So Emerson, this might look like you someday, helping animals getting spayed or neutered. How does that look to you, Emerson?
Cool.
She's like, Benjamin, what about you?
Baby.
Yeah. Thank you, everyone. Thank you. All right. Well, Dr. Wright, thank you for taking time out of your
Yeah,
day.
you're
to
welcome. If you
talk
guys come up with any
to us.
questions, let me know.
That's amazing. Campers, what do you say?
Thank you.
You're welcome. I'm glad you stopped by.
Thanks, Dr. Wright. Bye-bye.
Okay.